this edition of Training in 10. I'm Hamp Ingram, and today we're going to be discussing EMS response to firefighting operations and how EMS providers are an integral part of those firefighting operations as a part of the public safety team. Sudden cardiac deaths account for roughly 40 to 50% of annual duty-related fatalities in the fire service. Firefighting can activate several duty-related physiological stressors, such as that resulting from strenuous physical work, sympathetic nervous system activation, heat stress and dehydration, or environmental stressors. These stressors can also be affected by external factors such as the type of work the firefighter is performing and those individual characteristics of each firefighter. The cardiovascular responses, such as increased cardiac work, altered vascular function, and enhanced coagulatory potential, could lead to physiological recovery, but oftentimes it can also lead to sudden cardiac arrest. During firefighting operations, EMS is often dispatched because of the multiple risks that firefighters face. Research has documented significant cardiovascular strain among firefighters due to the stressors that they encounter. These stressors might trigger a cardiac event in firefighters with underlying cardiovascular disease. Indeed, the most common life-threatening condition for which EMS will treat firefighters is a sudden cardiac event.
The average cardiac arrest requires an all-hands-on-deck mentality, especially with all of the actions that must take place, such as intubation, medication administration, vascular access, defibrillation, airway management, and documentation. But now, consider the event and add in the uniqueness of the patient being a firefighter. This adds a completely new dimension to the resource demands. So now you need to ask yourself the following questions. Look beyond patient care techniques, and the answers to these questions will dictate additional actions that you have to take.
Is the firefighter wearing PPE? If so, you'll need to take the appropriate steps to remove it. Is this still an active scene? If so, you need to make the appropriate assignments and reassignments to ensure activities such as fire suppression and hazard mitigation continue. The company with the injured firefighter is no longer an available resource. How many ambulances are on scene? The fallen firefighter will be transported off of the scene by ambulance regardless of the severity of the injury. This ensures that not only the best care is provided, but it also removes the distraction created by a fallen member at an incident scene. Many departments issue an additional alarm at the initiation of a firefighter mayday, so while this is good, EMS resources are sometimes not accounted for in these added alarm assignments. You need to account for EMS resources to maintain the capability to treat any additional firefighters, and it's also recommended that you assign 2 ambulances to any significant incident, 1 to treat civilians and 1 to treat first responders. So now you have a victim. How do you get to them, or how do they get to you? The front porch or the front yard at the base of the steps or the warm zone is no place to properly and safely render patient care, even if the EMS providers are cross-trained firefighters. The extraction of the injured firefighter from the fire building must continue until the patient is at the location of the EMS crew in the cold zone. Without this direction, patient care is going to start wherever the rescue team deposits the patient. Okay, first things first, make sure your patient's been decontaminated. After that, the first patient care priority must be the safe removal of the firefighter's SCBA and PPE to ensure that EMS providers have maximum access for patient care interventions like IV access, drug administration, intubation, and etc. All removed clothing, PPE, and SCBA should be promptly bagged so as not to lose or contaminate any items for the ensuing injury or even death investigation. Okay, let's discuss firefighters with burn injuries. Overall, assessing your burn patient is done the same as for any other trauma patient. Start with your primary assessment, which is the ABCs, airway, breathing, and circulation, and continue through with a hands-on assessment, looking for any injuries or issues. You still treat life threats as you come to them. Once you have found the patient's injuries and have treated any life threats that you can, focus on your assessment and treatment of injuries, such as burns. When assessing burns, you must determine the severity of each burn. Burn severity is based on 6 factors, which follow: the agent or source of the burn, the body region affected, the burn depth, the extent of the burn, the patient's age, and the patient's medical history. The source of the burn is important to know because it can also lead to other issues that may arise during your response. Patients with chemical burns must be decontaminated if they're not already. Patients with electrical burns may have internal injuries far more significant than external wounds. When considering the body region burned on your firefighter, you must again remember that any burn to the face or airway is a life threat. Those injuries will compromise the airway because of swelling and physical damage. ALS burn treatment includes additional considerations to assist the patient, which fall under the following categories. Airway management. Because of the high probability of airway swelling, consider early intubation. This assures that even when swelling of the trachea occurs, the airway is open. If the airway has been compromised prior to the ALS provider's arrival, consider a surgical airway, and remember that airway access is the highest priority during treatment of this or any patient. Fluid resuscitation. Because of the heat from the burn, there's a great need to support fluid replacement during treatment and transport. Establish at least 1 large bore IV, preferably 2. If IV access is unobtainable because of the severity of injuries, then consider intraosseous or IO access and follow your local protocols. Of course, with any severe burn patient, we need to consider pain management. With IV access established, we can be aggressive with pain management. With the administration of any narcotic, always remember to closely monitor your patient for any changes. Once the patient is packaged, transport becomes the priority. Transport burn patients to the local burn center as per local protocols, and when transport time is delayed or made even longer, consider air transport. While transporting the patient, remember to monitor vitals, airway, and interventions. Ensure that IV access is maintained, pain is successfully managed, and no additional problems arise prior to arrival at the receiving medical facility.
EMS response to firefighting operations entails multiple concerns for the ill or injured firefighter. We must be prepared for whatever comes our way and be ready to monitor all of our patients closely for trending. Stay on top of your interventions, be it an advanced airway, IV access, drug administration, or cardiac or burn care. Always protect your patient by protecting yourself. Thanks for viewing our first installment. I'm Hamp Ingram, and I sincerely hope you enjoyed watching this video short as much as I enjoyed producing it. It was a bit of a challenge, but I hope to do many more in the future. Stay safe, and we will see you till next time on Training in 10.